Hello, my name is Kate Cronin. I am originally from Rochester, Minnesota, and attended Viterbo University in La Crosse, Wisconsin to pursue a bachelor's degree in nursing. My last semester of nursing school, I was placed at Mayo Clinic Rochester on the unit of organ transplant for my clinical capstone experience. On this unit, the patient population was mostly kidney and liver pre-operative and post-operative transplants. It was a unique experience to see patients before and after their transplant, and exciting to see many of them drastically better after their transplant. This made the experience worth it as it was rewarding to see patients recover and ready to return to their normal lives. However, organ transplant is a major surgery with a strenuous recovery and many complications can arise. One of the most interesting complications I was able to see on the floor was a urine leak post-operative to a kidney transplant. The patient was discharged 2 days prior and came back to the emergency department complaining of intense pain, rating it a 9 on a scale of 1 to 10, and a buildup of fluid in the abdomen. Within a few hours of getting admitted to the floor, we were able to get him to CT. It was then confirmed that he had a urine leak. Later in the day, he was scheduled to go back to surgery, and after he felt much better, and it was apparent that his pain had decreased significantly. This was very rewarding to see, knowing that I played a role in getting him treatment and helping relieve him of some of that intense pain. I really enjoyed being part of the interprofessional healthcare team. I was able to implement my professional values such as autonomy, human dignity, honesty, and being culturally sensitive to others and their beliefs. Autonomy was achieved by giving patients the right to make decisions about their healthcare and always allowing them the right to refuse. This was carried out when patients did not want to take their medications or ambulate. Both of these are very important when recovering from surgery, but the patient has the right to refuse all cares. Human dignity was implemented by by always covering areas of the body and only exposing areas that needed to be assessed. Honesty was demonstrated in every interaction with patients as they have the right to their healthcare. Being culturally sensitive was implemented when treating a patient that did not speak English. It was always important to have the interpreter nearby and ensure that we were addressing the patient and their family rather than the interpreter. I was I was also able to achieve my goals for capstone by growing in confidence, improving my SBAR ability of giving and receiving report, and increasing my understandings of medication. My confidence grew more and more every day that I attended clinical. It will continue to grow as I start my nursing career. My SBAR abilities got better as well. My preceptor still had to add more information when giving report, but there was significant improvement over the course of my clinical experience. My knowledge regarding medications also continues to develop. I was getting fairly confident with most of the medications given on the unit. However, medications will be a career-long learning as there are many things to remember about each medication. I was very pleased with my capstone experience, and wasn't as challenging to transition from a student nurse to working in the clinic setting as I thought it would be. There are many barriers, but but I was surrounded by people willing to help me, which made my transition much easier. I'm looking forward to starting my nursing career this summer. Thank you.